Welcome to Akram Kubanychbekov and Cianán Russell from ILGA-Europe. I'm really happy on behalf of IRIS to welcome you to this series, Conversations with IRIS, with the particular focus today on LGBTIQ people, communities and organizations in a time of Corona.
Thanks very much for having us on today. I'm excited to see sort of more uptake of these conversations in a broader spectrum of spaces. So thanks very much for inviting us. In terms of how, if we start all the way at the beginning of the COVID-19 crisis, all of civil society was all at once hit by a policy-making black hole. There was this brand new problem that nobody had any information about or knew what to ask for or what the basic issues were. And so everyone was just kind of guessing collectively. We went through this really sort of complicated phase of, well, I think this is probably a consequence. Here's another, an exchange among civil society, and it became really apparent to us that that exchange was a political moment that we needed to figure out how to get into. That it was going to be vital for the rest of our advocacy work to get in the right way as early as possible into the political moment. And so what that resulted with among our team at ILGA-Europe was first to brainstorm the types of areas where there were potential consequences. And we did that really so that we could create a research methodology that was as low threshold for response from our members as possible, because what we were observing was everyone was overwhelmed. Everyone was trying to scramble. So we couldn't do, in-depth qualitative interviews with all of our members. I mean, for one thing, as you said before, we have over 600 member organizations, but for another, not one of them had the time to do even a 30-minute interview with us. And so we tried to come up with something that was relatively low threshold. So that started with brainstorming. What are the areas? And then the survey we developed was a yes, no, explain style. So we asked on all 7 of these areas, plus the good practice. So really there were 8 sections. Are these kinds of problems happening? So are you seeing health or access to health problems, for example, in terms of continuing appointments, surgical follow-ups, etc.? And then please explain or provide examples if yes, for each of the areas. And we used that approach so that at the very minimum, people could go through and tick yes or no, and at least we would know in that country, yes, it's happening, or no, it's not happening. And from that survey, we got responses from 30 of our member countries, which is over half. We were happy with that, but at the same time, we were looking at other research being conducted by other NGOs, as well as trying to just incorporate the direct feedback we'd received from our members. So in the end, we got responses from about 40 countries, plus a couple we incorporated a couple of things from other regional NGOs, like from ICRC. They were doing a specific type of outreach, so we incorporated that into our analysis as well. And then our goal with the production of the report itself was to produce something that looks like what state stakeholders see. So we went with a really, are these things happening and in what countries, how many countries, which countries, and then to provide some examples of what it means. So it was very much focused on the style of paper that regional policymakers and national level policymakers are creating for each other, that they receive from human rights bodies, and then to sort of move the conversation forward.
obviously from your report, I read that healthcare was one of the big areas that people wanted to talk about. So Cianán, could you perhaps tell us a little bit more about what you found in relation to access to healthcare?
Yeah, absolutely. I think it's first important to start with what were things like before the pandemic, and in the pre-coronavirus world, LGBTI people experienced significant stigma and discrimination, bias from healthcare providers, as well as other sort of societal marginalizations that lowered our community's access to the highest quality of healthcare. That's something that's been recognized both by research and by international human rights institutions for quite some time. So we weren't starting at parity, we were starting behind to begin with. And what we then asked and looked for was what were the consequences on access to health as well as on the status of the health of our community members. And one of the threads that I think is worth talking about is that a lot of the mental health work around LGBTI people comes in the form of peer-to-peer support spaces, and all of those had to close. And we know that the mental health outcomes among LGBTI communities, again, before the crisis, were already lower than the general population. And one of the pieces that was in place was local peer-to-peer. We get together and sit around for half an hour in a circle and talk about how we're doing, and then we have a drink or a coffee, or we play a board game or whatever. These are really vital to the mental health of the LGBTI community, and they were lost, or had to be radically changed. So a lot of our members were reporting that. And another significant thread is the impact on the health of trans people and their access to transition-specific healthcare. In 26 of the countries that we reviewed, there were reports of either complete blockage or massive delays of transition-specific healthcare. And again, it's necessary as well to tie that to pre-COVID times when there were already really long delays in most states in our region when it comes to especially starting transition-related healthcare, starting hormones, or even starting psychiatric evaluations where those things are required, with waiting lists of 6 months, a year, 2 years in some places. And then what happened when the coronavirus pandemic hit was all services stopped, and more people continued to get put on waiting lists. And so now the waiting lists are 50% or 100% or 200% as long as they were before. And the centers that were providing this care took a really long time to figure out, can we do it via e-health? Can we do it via telehealth, so that we can start to process appointments again, or not? And in addition to that, all healthcare workers were under massive strain. And so it's not like they were sitting around twiddling their thumbs. We don't mean to make that accusation. They were trying, but they were also being pulled in lots of directions, and that's just created a very significant backlog and delay in access to transition-related healthcare, which in its sort of carry-on effect is an impact on mental health of trans populations. I mean, we did receive reports of even follow-up care to surgeries that happened before March being delayed or canceled. Some really disturbing reports of people not being able to have stitches or catheters removed for weeks or even months because they couldn't get follow-up care. So there's a significant issue there. For the intersex community, there's a different problem which manifests in there being a very small number of trusted service providers for people with variations of sex characteristics. And because many intersex people are exposed to medicalized violence, either as infants and children, or in sort of a continuing way and as barrier to their access to care, that trusted relationship with a specific service provider is central to be able to get healthcare, because there's a trauma in that space that has to be managed to be able to just continue to do any healthcare. And for most intersex people, that person is not in their city. It's not someone they could walk to. They travel hours or even outside of the country to go to this service provider that they trust. And lockdown meant you can't see the service provider. So either you're going to see someone that you don't trust in a traumatized context, or you're not seeing anyone at all. And most of the reports that we've heard indicate that people are not seeing anyone at all. And there's a new report coming out probably in early December from our member and partner OII-Europe, which is Organization Intersex International Europe, that will report that nearly 2/3 of the intersex people who responded to their survey reported significantly worsened mental health outcomes in the time of the crisis. So there's a serious mental health crisis. And I think the last piece, and I will stop after this, is in relation to HIV care and sexual and reproductive health care. The crisis meant that a lot of the in-person checkpoints that people used either to get testing or to get treatment for those who were already HIV positive, or for people who were on preventative interventions like PrEP, that those were closed and were unable to have in-person meetings. And the legislative framework in many countries meant that there was no opportunity for self-testing, so to mail test kits to people at home, or even for online consultation, because the legal framework said you can't do these things. So there was a pretty large gap in time where HIV services were either stopped or radically curtailed. And the most concerning impact of that was that for many people, access to their antiretrovirals, people who were HIV positive, was delayed or impacted in some way, and that's terrifying, right? Because that can easily cost lives. And in a lot of cases, NGOs stepped in to try to ensure that people were able to gain access to that continuing medical care. But the infrastructure failed in making sure that HIV positive people had access to continuing ARVs.
The HIV community has often led the response, because we have so much to learn from our community actually about dealing with a global pandemic or dealing with a health crisis, that I think we have a real resource within our LGBTIQ community to understand and support each other, and also use what we have learned and the resilience that we have built within our own communities to show the way to others, even outside of our own communities. And in terms of domestic violence, that's been another really crucial area. And Akram, could you perhaps tell us a bit about what you found in terms of the impact within this particular area on LGBTIQ people's lives?
LGBTI phobia, we can meet it on the streets, in our working place, and in our families too. And this LGBTI phobia forces usually how LGBTI people cope with domestic violence. It might be psychological, sometimes physical, and financial, and among others. And how usually LGBTI people cope with the domestic violence is they leave the houses. And if they're lucky, then they will rent a place, their own spaces, and so leave this violent environment. But when, and at the same time, we should admit that as many studies shows that majority and high number of the LGBTI people are in the precarious jobs or they're financially unstable because of the LGBTI phobia in the employment environment, among others. So, and this led when pandemic happened, in many countries, people lost their jobs and they didn't have the access to the public relief programs, or they couldn't, for example, pay just rent, and they had to return to their families, or they were usually they couldn't go out because of the lockdown, and this just multiplied the risk of the being under the or facing the violence from the homophobic or LGBTI phobic member of the family, or your roommate who might not be supportive of your sexual orientation, gender identity, or sex characteristics, so the person you are living with. And we found out that in 23 countries, from reported 40 something, 23 countries, there was the spike in the domestic violence in the reports. And the most affected parts were the LGBT youth, because LGBT youth and LGBT people with disabilities, because then when tension builds up in the family, and lockdown is not really good for mental health of everyone, and usually the most vulnerable suffer from it. And also the LGBTI elderly in some countries, they were also reported. But that also what adds up is that in many countries, and it's not only, as we sometimes guess, it's in the Central Asia or in the Eastern Europe, but in the all parts of the Europe and Central Asia, it's that domestic violence is seen as just a violence against women. It's usually like husbands beating up the wife, but it's more than that. And whatever happens within the family unit or within the household, as it might be also roommates, or in the relationship, and because of this legal framework, which makes it just a protection provided to the women, specifically in the heterosexual relationship. This excludes LGBTI people, and in some countries they do have intergenerational violence in the domestic household, but unfortunately it's not in many countries, and many countries still don't include also intimate partner violence among the LGBTI people, and as a consequence, the prevention programs, for example, awareness raising about the services, they all are not LGBT inclusive. And for example, when LGBT youth face the domestic violence, they don't know where to go. And as you know, many of the LGBT organizations where they could go, they were closed or forced to close, and they were left alone. And also how they couldn't reach out to their social support group, which would be the other LGBTI people, as Cianán was saying, that they couldn't gather. So, and being in the household where you are controlled or don't have the space, you couldn't. Your risks of reaching out, your chances of reaching out to the right services and to right people is very low. And yeah, this was, and our members also confirmed that many countries, they don't have LGBT specific shelters, and this also trans women also don't have, even they have the shelters for women. Usually trans women don't have access to the shelters.
I think being able to recognize and speak out also about intimate partner violence is important. And certainly over 20 years ago, when I did this research, and then I became a founding member of Broken Rainbow, we were trying to raise awareness about intimate partner violence within our own communities and receive something of a backlash from within our own communities because of the fear of talking about abuse which could exist within our own relationships at a time when people felt we really needed to be focusing on the homophobia we were experiencing from outside of our communities.
But in my opinion, this is still the struggle, because we do face the LGBTI community, the LGBTI phobia from the society, and that's why we don't want any negative associations, because we already have very negative associations. And I think this is the part of why some people might take, within the community, might take this position.
In the context of all of the political scapegoating and instrumentalizing of our communities, we certainly see less space for internal debate and less opportunity for disagreement among our community. And so, you know, there is the positive impact in those types of circumstances of communities coming together and more solidarity, but solidarity and coming together can happen in ways that sideline the most marginalized, that focus really on only the things that we can have consensus on, and push more radical issues or push more marginalized people out of the discourse. This next comment is really my own observation and not the observation from the research specifically, but one thing that I feel is not happening as much as I might have feared is further schism within our community around sex work. It feels like things have become more consolidated and there is more building of solidarity, but it could have gone either way, right? It could have gone with the community saying, no, we need to focus on LGBTI issues, just the sort of blank canvas LGBTI person, right? Or we need to develop solidarity with sex workers, many of whom are LGBTIQ and many of whom share the same problems as us. And in the past, it has gone the other way. It's especially in Europe, with distancing the LGBTI movement from sex worker movements. But this time around, it seems like it's coalesced a bit more, and these movements are working together more as opposed to working at odds with one another. So that, you know, there's a complicated consequence of functioning in a repressive political environment, and, you know, trying to figure out how do we make sure that everyone is at the table, or that all of the issues, especially those issues of the most marginalized, are addressed. So what you were saying just kind of made me think about that issue as well.
Yeah, and I think having these really complex discussions is really crucial, because talking about schisms, of course, we will be aware of the schism that the media has really pumped up and promoted around trans and lesbian women. We come from very different experiences, despite the fact that we are all part of one LGBTIQ community. And I think maybe for far too long, not that we've allowed it, but people outside of our community have taken control of our agenda. And somehow, in the same way that you're demanding that after this pandemic, we want to take the agenda back, and we want to reclaim our human rights, and we want to return to something that was in place and that was developing before the global pandemic, maybe we can take it a step forward and say, we don't want to go back to what we had. We actually want to go forward to what we want and demand. And so with that in mind, it also links very much to the sort of general access to public relief programs. I mean, of course, domestic violence links very closely to health, but it also links to housing, to access to money. And I know that housing and homelessness has become a real issue during this time of pandemic. So Akram, I think you probably are in a position to say a bit more about access to public relief programs.
Yes, as we might know that these are complex issues, and we need to at the as our latest annual gathering online. It's usually annual conference, but instead of it, we made the gathering online. And during the discussions, actually, most pertinent uh, issue or for the LGBTI people, it was the economic and financial well-being, I think. And this is by the public relief programs. And as in the report, you can see that in the many countries, there were reports of the issues with the access to the public relief programs. And it is not only, as I will emphasize, most of it was in the Eastern Europe and Central Asia, but for example, in Germany, trans sex workers had issues with accessing public relief programs, and also as Germany also recognized the non-binary identity, they also couldn't because as by default it was for male and female gender, and they couldn't access because of this simple bureaucratic paper. Uh, and but at the same time, the public relief program is very, very important because this is your housing, this is your food, and this is your security, because without housing you will be on the homeless, you will be on the streets. And streets when it comes to LGBTI people, and also as to the many people, but because of LGBTI phobia, this also means for you that street living on the street is the harassment by the police, harassment by the bypassers, or at night that also must be physical or sexual harassment and violence. So we can see that this is also a very, very big issue for LGBTI people, and at the same time governments and even at the EU institution, they try to build inclusive relief programs and policies, but unfortunately, they're leaving out the most vulnerable people, because when it in this kind of situation, it's a usual practice, unfortunately, and that's why we are making this research and also trying to persuade. I can say that that we are relevant and we are also humans.
I mean, I think that's an excellent point. We are one race, the human race. We are all human, and it's our humanity that connects us. But like you also said, we come with multiple identities. We have our own intersectional identities that bring us together, that can separate us, none more so than when we think about border crossings, and how as migrants or people seeking asylum, that can often place us or those people at the most extreme margins of society and even of our own communities. So I myself am a British citizen living as a migrant now in Germany, and I now have German citizenship based upon her first applying for German citizenship, which then allowed me to apply for German citizenship. And that's a rather long introduction to talking about my experience during Corona, because I still work in the UK in IRIS, who I'm representing here, and was commuting. But when we knew that Germany was closing its borders, I had 45 minutes actually to make a decision about whether I remained in the UK or I returned to Germany to live with my wife. Fortunately, because we are married and Germany recognizes our marriage, and because I had managed to gain German citizenship through my marriage and through meeting all the criteria that was required of me, when I got to the border, I was allowed to return to Germany. Other British passport holders were turned back to the UK. So that was a very small example in my own personal life of how, despite my privilege, the ability to return to be with my wife during a global pandemic was questioned, and I managed to get across because of the access that my citizenship and my marriage and the recognition of my marriage gave to me. But I know that in European countries or other countries where that marriage or that civil partnership or that relationship is not recognized, people were not able to return to be with their partners during this lockdown and during this global pandemic.
I am originally from Kyrgyzstan, which is in Central Asia, and I am living currently in Germany, and I am living here, and I have status only because, and I'm quite privileged. Besides being person of color, I'm quite privileged because I have the higher degree, and I have a employment, and I can also work online, and I am here because of I'm married to the German citizen, and I can, as you, I can remain here and work. Yeah, at the beginning, I work in Brussels because ILGA-Europe is based in Brussels. And so in order to work in Brussels, the German permanent residency wasn't enough, but I should receive another the work permit in Brussels. So it took quite long. And because of the health insurance being in Brussels, but I'm living here, it took me for like 6 months because of the lockdown, and it was quite very, very slow. It took me 6 months when I was without health insurance. I had health insurance, but without access to healthcare, to the non-emergency healthcare in Germany. So this is one of the obstacles I see, but I know that I'm privileged, and my position compared to when I think about my position, and at the same time think about, for example, undocumented migrants who doesn't have, they cannot leave the country at the same time, and they cannot access the public relief programs, healthcare, and so with the offices being closed, how they are surviving. This is for me big question. And also the other point is that working and being migrant here is also having toll on me mentally, because I miss my family dearly, and I cannot visit them. And yeah, that's my personal side of how it is impacting.
I mean, I'm also a migrant. I'm a U.S. citizen living in Belgium. I have residency here, but my family, my immediate family, is all in the U.S. And my partner lives in Argentina, in South America. So there's, I think probably the easiest connection is to talk about the mental health of our communities and isolation, right? I certainly have found myself really struggling with being trapped in a small apartment with my cat and not knowing when I'm going to see my family, my mother or my sister, my nephews, or my partner again, being afraid that they might get sick and I might not be able to go back. Or on the flip side, being afraid that if I did go back, I might not be able to get back in. Technically having a Belgian residence card should mean I can return, but things happen and circumstances change. And do I want to risk losing my life here to be able to go to two places in the world, Argentina and the US, that are really badly hit by the virus at the moment? So there's a lot of decision making that we have to do. And I think across the board, one of the things that we saw in the research was that LGBTI people are feeling and felt from almost the very beginning of this crisis, the pressure on their mental health and well-being that NGOs have worked really hard to try to figure out how to fill the gaps. I mentioned earlier that the social support programs have had to close or pause or move online, but now they've taken to it. We run our social support programs online. We've come up with new mechanisms for taking care of each other, and are trying to figure out how we move forward as a community that really depends on each other in a way that is resilient, robust, and well. And I know this is kind of moving into the good practices, but there's one specific one that I've been wanting to say, which is there is a peer support group for trans youth in Ireland that had to stop running for a long time, and then what they decided to do was to turn it into a program they call walk and talk. So they're outside and they go for walks and chat in the similar way to what they were doing previously, sitting in a circle in chairs inside. And while it seems like a really simple solution, it's radically different than sitting here on the camera, right? And it's relatively safe. You can walk 6 feet apart and still have a conversation with someone, and feel a bit of that community, feel a little bit less alone. I think we've been really creative when it comes to figuring out how to take care of our collective mental health and well-being, and there's a vibrancy there that I think is really profound.
What I wanted to highlight is that I was inspired by the resilience, solidarity, and unity of the LGBTI movement, activist organizations, how they, I told you before that there was lack of the public relief, access to the public relief programs, and for the LGBTI people. What activists, just the LGBT people who are not activists, they stepped in, they started fundraising and helping to distributing food, housing, for example. I know the situation it's not activists and it's not in our report, but what inspired me that just the people, LGBTI people, were opening their houses to take in the people who were left without the housing. And that inspires me. And this is the really, really good practices of the humanity, which I highlighted before. That we might have differences, but I will open my house because now we are on the crisis, and I will welcome you in my house, despite our differences. We might even not agree, because I know these two people, they don't agree in many, many things, but still one person just opened their heart and their house to the other person. And I think these are the best practices I would like to see, and we should amplify, not only among the LGBTI people, but among our, let's say, race of the humans.
And that certainly is really inspiring. And it brings us back to that idea of what is it that we can do within our own communities for each other, but also what can we teach people outside of our community about how we are building solidarity and support and resilience and knowledge that people outside of our community can also learn from. But to end with, could we perhaps look, coming back to you, Cianán, at the recommendations for state authorities and the responsibility that we think they have and what they should be doing to really respond to the concerns that your research has raised?
Yeah, I think that probably the easiest way to answer this question, because we have a lot of very specific things in the report, but the easiest answer is that state authorities need to think about who's at the table in crisis planning and crisis management conversations, because all of the issues that we raise are issues that had someone either from the LGBTI community or who talked to LGBTI people been at the table at the emergency measures discussions, or at the crisis management discussions, or at the pandemic planning discussions, would have raised. We would have raised, trans people need access to continuing hormone treatment. We would have raised that HIV medication there needs to be longer prescriptions so you can get more medication in case you can't go out of the house. We would have raised that we are already economically not equal with cisgender heterosexual endosex people, and so we're going to be hit more firmly by economic crises, or that our employment is more precarious, and brought that into the conversation. All of the sort of specifics lead back to one general recommendation for states, which is you have to acknowledge that these people exist in your country, that we are there, that we know what we need, and ask us before it's too late. I think that's the major takeaway I would have for state actors in this discussion.
Thank you. And that's a good way to conclude, because I'm really grateful to you both that I was actually able to ask you both what your study has found and what your recommendations are, and that together in partnership with IRIS, we can create this platform where these kinds of conversations can take place and can be shared with policymakers, with frontline professionals, with community organizations, with the general public, with people from within our own communities. And that through the sharing of good practice and ideas and challenges and recommendations, we can progress together. So thank you very much, both of you, for your time. Thank you also to ILGA-Europe for the contribution that you're making to these discussions and to progressing our rights as LGBTIQ people. And I wish you all the very best from myself and on behalf of IRIS for your continued work with ILGA-Europe.
Yes,
Thanks very much, Don,
for inviting and giving us a platform to speak and to share our findings. Thank you a lot.
Our pleasure.